everyone and welcome to our Dr. Dad Talk Show. I'm your host Indu Bala and today we have a very special guest with us, Dr. Shalini Chaudhary, the gynecologist. Let's welcome to Dr. Shalini Chaudhary. Welcome ma'am, welcome to our show.
Hello everyone, thank you. Hello everyone, I am Dr. Shalini Chaudhary. I am senior consultant and laparoscopic surgeon practicing in Dwarka, Delhi.
We have received many questions from audience. We have shortlisted some of the questions. Shall we start now?
Yes.
Okay. What is PMS aka premenstrual syndrome?
Premenstrual syndrome is there is a group of symptoms which occur between ovulation and the menstrual cycle in many women. These symptoms are mood swings, depression, tenderness in the breast, fatigue, weakness. These are all many a times they are normal symptoms and they can be taken care of with lifestyle modification, meditation and good eating habits. But many a times the symptoms are very severe, then they should reach to a gynecologist and take some drugs are required, then they can take them. So these are basically because of the hormonal changes.
Okay, thank you for your answer ma'am. Move to next question. I have a lot of vaginal discharge. Is daily discharge normal? One teenage girl asked this question.
Yeah. In teenage girls, afterwards also, if the discharge is happening, which is mucousy in consistency, the color is clear, and there is no foul smell or itching associated with the discharge, then that is normal.
Okay.
So don't worry about that. But in case of bacterial vaginosis, when the infection is there, then they need to see the doctor when there is itching or a dark yellow colored discharge or a fishy odor is there.
Okay.
Yes.
Thank you ma'am. Thank you so much for your answer. Okay. और मैम ये जो ये डिस्चार्ज होता है इसका क्या कलर भी चेंज होता है?
हाँ, ड्यूरिंग साइकिल थोड़ा बहुत कलर चेंज होता है थोड़ा, बट म्यूकसी और वाइट डिस्चार्ज. लेकिन अगर वो थिक white discharge hai with dark yellow color, then there's a problem.
Okay ma'am. So next question, why do I experience heavy bleeding during my periods and what can I do to reduce it?
Yes, heavy bleeding during periods, if you are, we can categorize it this way, that if you are changing pad or your tampons every 2 hours, then we consider it as a heavy bleeding only. Okay. During first 2-3 years of menarche, when they start bleeding, the cycles are anovulatory, and during first 2 years it is alright to have irregular periods and heavy bleeding. For that much treatment is not required. But if on further after first 2 years of menarche, if the lady is suffering from excessive bleeding, then they need further evaluation like certain blood work and ultrasound etc. to look for any fibroids or any endometriosis, and there might be hormonal change as well.
Okay ma'am. ड्यूरिंग दैट पीरियड कितने टाइम तक ये चेंज करना होता है? लाइक हमें जो अपने पैड्स वगैरह यूज करते हैं, टैम्पॉन्स वगैरह, क्या ये सेफ रहते हैं?
हाँ, टैम्पॉन्स तो एब्सोल्युटली सेफ होते हैं. आप डिपेंडिंग अपॉन 5 to 7 पैड्स अ डे आप चेंज कर सकते हो. रात में अगर आपको सोने के बाद भी चेंज करना पड़ रहा है, then it is a problem. Then you can think of excessive bleeding. Otherwise overnight एक टैम्पॉन या एक पैड should suffice.
Okay.
अगर आपको डबल पैड यूज करना पड़ रहा है तब भी आप सोच सकते हो कि ब्लीडिंग हैवी हो रही है. उसके लिए आपको गायनेकोलॉजिस्ट से मिलना चाहिए. थोड़े आयरन सप्लीमेंट्स, मल्टीविटामिन, ये सब, और बाकी जो अल्ट्रासाउंड वगैरह. अगर
और मैम अगर ब्लीडिंग कम भी हो, लाइक अगर 3rd और 4th डे में जैसे कम हो जाती है ब्लीडिंग, तो क्या उसमें भी जरूरी होता है पैड चेंज करना?
नहीं, मतलब इतने 5 to 7 पैड्स आपको, जब हैवी फ्लो है, सेकंड डे यूजुअली लोगों को हैवी फ्लो होता है तो तभी करना होता है. फिर वो धीरे धीरे कम होता चला जाता है, तो आप नंबर ऑफ पैड्स भी कम कर सकते हो. पैंटी लाइनर्स भी यूज कर सकते हो व्हेन द ब्लीडिंग इज लेस.
ठीक है, थैंक यू मैम. नेक्स्ट क्वेश्चन, कैन यू सजेस्ट अ वैक्सीन दैट एवरी टीनेज गर्ल शुड टेक? Why do you think is that important?
Yes, mouth of the uterus is called cervix, and there is a cancer called cervical cancer. So all teenage, including not only teenage, the adult women also should take cervical cancer vaccine. Cervical cancer is a very deadly cancer. Every year 1,22,000 cases are detected of cervical cancer, and out of them 65,000 they die of the disease.
Really?
So it is, yes, it is 50% actually. So there is a vaccine available which prevents against this cancer. All girls which are falling between the age of 9 till 15 years have to take 2 doses, and those falling between the age of 15 to 45 have to take 3 doses. Almost all gynecologists here, especially in Delhi, so they have their vaccine available at their clinics. So, and the hospitals also, they are keeping the vaccine, so they can reach the hospital or the respective gynecologist and take the vaccine. It is very important to take this vaccine.
Yeah, ma'am. I think मुझे लगता है किसी बहुत से लोगों को तो पता भी नहीं होगा इस चीज के बारे में, इस वैक्सीन के बारे में. It's really a valuable information, ma'am.
Yes,
Thank you so much.
All right.
Okay, move to next question. It's what is VBAC? Your insights.
Yeah, VBAC, as we call it, is vaginal birth after cesarean section.
Okay.
So if you've had a previous cesarean delivery, there are 2 ways you can go give birth to your next child. Either it is a scheduled cesarean section, or you can go for vaginal birth after cesarean section.
Right.
So this can happen, and the advantages of vaginal birth after cesarean is that no abdominal scar is there, the risk of infection and excessive blood flow is less. But then there are certain contraindications to vaginal birth after cesarean, like if the patient is having renal disease, heart disease, or the previous scar is thinned, then we cannot go for a vaginal birth, and the patient's pelvis is narrow. Then they cannot go for a vaginal birth after cesarean. So that assessment is to be done by the gynecologist. But yes, it is possible to have delivery after 1 cesarean previously or 2 cesarean previously. There is a certain risk associated with this kind of delivery, which is the scar rupture, which can be dangerous for you and your baby as well. So it has to be done under guidance and in a good hospital.
Yes, okay, thank you, ma'am. And next question is, most of the mothers find it very difficult to breastfeed, especially first timers.
Yes.
Please tell 5 super solid advices that will surely help.
In my practice, I have seen that many a times actually they are engrossed in so many things even after delivery that they try to rush for feeding the baby. So first of all, they should sit comfortably, use pillows or cushions to sit comfortably. That is very, very important. Then forward bending, forward bending should not be done. You should not bend forward to feed the baby, and lift the breast in one hand, and your fingers should be before areola के पीछे रहना चाहिए. ऐसे नहीं that you are squeezing the breast. That should not be done. And lift the baby on the other hand and then feed the baby. Plus you can tickle your nipple on the baby's lips so that the baby opens the mouth. And your you should aim your areola towards the upper lip of the baby.
और मैम ब्रेस्ट फीडिंग का मतलब कितने टाइम तक पिलाना चाहिए बच्चे को, क्योंकि आजकल की न्यू जनरेशन्स में ऐसा है कि उन लोगों को नॉलेज ही नहीं है.
Minimum 6 months, but it can be stretched to 1 year, definitely.
Okay, ma'am. Thank you so much, ma'am. Any takeaway message that you want to share with our audience?
Takeaway message from my side or any other doctor would be these days the kids are having lot of food, fast food from outside. So one must maintain the lifestyle, eat healthy, and there should be spiritual, mental, and physical well-being. So you should look after all this.
Thank you so much, ma'am. Thank you so much for your valuable, important things which you are sharing with us. And thank you once again.
Thank you.
Thank you, viewers, for watching us. And I hope you found your answers. Till then, bye-bye. See you.